Thank you for joining the community information session this afternoon, wherever you are, understanding and managing the effects of medical trauma in children and adults with spina bifida. My name is Judy Thibodeau, and I'm a member of SBA's staff. I am joined by my colleague, Juanita Panliner, SBA's National Resource Manager. I want to mention a few things before we get started. You will remain muted throughout the session. We want to allow the experts to respond to all of the questions submitted in advance of this session. You're welcome to submit any new questions to the panel of experts using the Q&A feature on Zoom. If time allows, the experts will answer any new questions today. Everyone who registered for this event will receive a link to the recording. Closed captioning is enabled. If you have any technical issues, please send a text to Juanita, 202-487-3988. This session is being recorded. Now, I'm pleased to introduce today's experts. Dr. Jackie Papadakis is a pediatric psychologist at Ann and Robert H. Lurie Children's Hospital in Chicago, and an assistant professor of psychiatry and behavioral sciences at Northwestern University Feinberg School of Medicine. Jackie works with children and adults with spina bifida as part of the Lurie Spina Bifida Center and youth with differences of sex development as part of the sex development program. She is also an attending psychologist on the Psychiatry and Behavioral Health Consultation Service. Dr. Tess Simpson is an associate professor and pediatric rehabilitation psychologist at the University of Colorado School of Medicine, Department of Rehab Medicine. Dr. Simpson is the co-director of the Spina Bifida and Spinal Cord Injury Clinic at Children's Hospital, Colorado, and she works with children and adults with spina bifida and spinal cord injury. One of Tess's many clinical interests include behavioral health intervention for youth struggling with adjustment challenges related to acute injury or chronic illness. Now, Jackie, take it away.
Thank you, Judy, and thank you everyone for being here this evening. Dr. Simpson and I are very excited to talk about this topic. This is a very important topic. Okay, here we go. So here is an overview of our talk this evening. I'm going to start us off by talking about what is medical traumatic stress. And then I'm going to pass it to Dr. Simpson, who's going to talk more about what we can actually do about medical traumatic stress. And then we're going to have a lot of time at the end to answer your questions. And as Judy mentioned, we received a lot of excellent questions ahead of time, and we really, really appreciate all of those questions. And I think this is a topic that we could probably talk about for several hours, but we only have 1 hour tonight. So we're going to do our best to answer those questions, but we might not get to all of them. And one more note is that Dr. Simpson and I created this talk to be directed towards children and adults with spina bifida and their caregivers and families. But we certainly think that this is going to be relevant for different folks as well, like including medical providers. So we hope that this is a useful webinar for you. So let's start off by talking about what is trauma. Well, when someone feels intensely threatened by an event that they are either involved in or that they witness, we call that event a trauma. And there are a range of things that could be considered a traumatic event. So it could be something like community violence, it could be a natural disaster, it could be the death of a loved one or experiencing grief. It could be domestic violence, interpersonal violence, abuse, war, other types of conflicts. It could be experiencing discrimination, bullying, or family separation. And of course, it could be about medical interactions. And so tonight we are focusing on medical traumatic events. So what could be a medical traumatic event? There's really a variety of things that could potentially be traumatic. So this could be something like experiencing a significant amount of pain, experiencing an injury, experiencing a serious illness in general. It could be when you receive a new diagnosis or when you learn a prognosis that's maybe not so great. It could be going through a surgery or a procedure. It could be having medical testing or invasive medical treatments. Or it could even be like a really difficult medical interaction. So there's really a variety of things that could potentially be a medical traumatic event. And so a medical traumatic event is what happened. Medical traumatic stress is the negative psychological and physical responses that someone might go through after experiencing that medical event. And there are 3 ways that you may experience medical traumatic stress, in that you may be the person that experienced the traumatic event itself. It could have happened to you, or you could have witnessed this traumatic event happening to somebody else. You could have seen it. Or maybe even you learned about a traumatic event that happened to a very close family member or friend. So the key here is that you can experience medical traumatic stress even if it didn't actually happen to you directly. And so what exactly is medical traumatic stress? Well, we tend to think about traumatic stress symptoms as falling into these 4 buckets. And I'm going to talk us through these 4 buckets. But what I really want you to remember is that traumatic stress varies for everyone. There are no 2 people who are going to experience traumatic stress in the same way. It could look very different for everyone. So the first bucket I'm going to talk about is something that we call re-experiencing symptoms. So this is if someone is having memories or dreams or flashbacks of the traumatic event. So an example quote of a thought someone may have who's having re-experiencing symptoms would be something like, quote, "It pops into my head and it feels like it's happening again." The next bucket of medical traumatic stress symptoms that someone could experience is what we call avoidance symptoms. So this would be trying to avoid thinking about the medical event, avoiding places that remind you of it, avoiding people that remind you of it. So it could be, avoiding going back to the doctor, to the hospital. It could even be like, I'm going to avoid that person because I know they're going to ask me about this traumatic event that happened. So an example quote that could demonstrate avoidance would be if someone said, quote, "I block it out. I try not to think about it," or "I try to stay away from the things that remind me of it." The third bucket of traumatic stress symptoms is something that we call increased arousal. So this could be if you're feeling irritable, maybe you start acting kind of recklessly, you're hypervigilant, which means you're kind of on edge, or you're just kind of waiting for something bad to happen. It could be that it's really hard for you to focus or you're sleeping really poorly. So an example quote here would be something like, "I'm always afraid something bad will happen," or "I can't concentrate, I can't sleep, I'm jumpy." And then the last bucket of traumatic stress symptoms is what we call like negative mood or negative thoughts. And this could be feeling really anxious, feeling depressed, feeling kind of detached from yourself or other people, having what we call distorted thoughts. So kind of thinking things that really aren't real or aren't realistic, and dissociation. And so dissociation can mean kind of similar to detachment, like feeling detached from yourself or other people, or kind of feeling like things aren't real or you're not really like living your life in your own body. And so some example quotes from this could be like, "I feel hopeless. No one can be trusted," or "It felt unreal, like I was dreaming." So, and I'm just kind of giving like an overview of all of the traumatic stress symptoms that someone can experience. There's actually kind of more detailed examples beyond this, but again, I just want everyone to remember that's what really important is that everyone experiences these things differently. And another really key thing to remember about medical traumatic stress is that it's related to somebody's subjective experience of what happened, of that medical event. In other words, it's related to their perception of the medical event. And so, maybe to one person, having a blood draw is no big deal. Maybe to another person, it's a very big deal, and it was a very traumatic experience for them. And so that's the key piece here, is that this is individualized. It's about one person's experience of it. And I think this is especially important when we think about kids who go through medical traumatic events, because oftentimes a child can experience something as much more intense and traumatic compared to what maybe an adult may view it. And these two pictures I have up here is just to kind of to exemplify how someone can see an animal approaching them, and maybe one person would view this animal as a cute little kitten, and another person sees this animal as an aggressive tiger. Perception matters. So a question that I hear a lot is, how is medical traumatic stress different from stress in general? And so, stress in general, someone who's kind of having what we would say is stress might say something like this. They might say to themselves, quote, "I have another long clinic appointment today. There will be so many exams and many people are asking me questions. I'm exhausted just thinking about it." Now, someone who's experiencing medical traumatic stress may be thinking to themselves something more like this. They may say, "I'm so nervous about my appointment today that I feel sick. The last time I went to the hospital, I was admitted to the ICU. I felt so much pain. I thought I was going to die. I don't know if I can go today." So there are many aspects of disease and illness and medical procedures that are stressful, absolutely, because they're painful, because they interfere with our life. But the difference with medical traumatic stress is that it really affects and seriously impairs everyday function. It gets in the way of living everyday life. So, why is it that going through some kind of medical event can do this to us? How is it that it can cause us to experience this traumatic stress? Well, a few things. When we go through a serious medical event, again, we're talking about anything from a surgery or receiving a diagnosis, or having a ongoing but really invasive treatment or rehab. These events can challenge our beliefs about the world being a safe place. It can make us feel like the world's not safe, and it can remind us of how vulnerable we are. And then often in the medical environments, there's a lot of like high tech, intense medical treatment that can just be really frightening and intimidating, no matter what your age is. It can make someone feel really helpless. Sometimes the medical environment in general and the interactions between patients and doctors can make patients sometimes feel like they have less power in those situations. Also, there's often just a lot of uncertainty about, how's this surgery going to go? Is it going to work? What's going to happen? Often pain is involved in many things that happen in the medical environment. And then lastly, oftentimes there's really important decisions that have to be made. And it's sometimes it can be really difficult. Do I do this? Do I do that? What are the consequences of it? Am I going to feel regret? So there's a lot of that also that characterizes medical events and can cause them to be traumatic. There's other important aspects or kind of characteristics of medical events that can determine whether this is something that causes traumatic stress for someone or not. So things like, did this medical event happen suddenly or gradually? Was this something that, all of a sudden it just happened and surprised everybody, or was this kind of unfolding slowly over time? How intense was this medical event and how long did it last? Were there ongoing complications afterwards? So, was somebody hospitalized for a very long time, but then even after the hospitalization was over, then they had to participate in kind of long-term, treatment or recovery efforts that just kind of added to or exacerbated the trauma of the hospitalization, for example. Were other family members directly affected by this medical traumatic event? And are the health effects obvious or visible to others? Sometimes when they are, that can exacerbate the trauma one feels, whether it's because people draw attention to it or people ask about it more, or the individual themselves might be reminded of it more. So again, these are all things that can kind of determine how a medical event can lead to causing traumatic stress or not. So, can medical traumatic stress be diagnosed? The answer is yes. So, a medical or mental health provider can evaluate and diagnose medical traumatic stress, and it would be considered kind of one of two different diagnoses. But to meet criteria for a diagnosis, you have to have multiple symptoms of those buckets that I was describing earlier, those like 4 buckets where you might be re-experiencing the traumatic event, you're avoiding it, you have increased arousal, you're experiencing negative mood and thoughts, you're having some dissociation maybe. So we as in mental health providers have very specific criteria, but you have to experience a range of those symptoms, and it has to cause significant impairment in your life. And if that's the case, then you might meet criteria for one of 2 diagnoses. If your symptoms have been occurring like between 2 days and 4 weeks from the medical traumatic event or in general, we would say that's called acute stress disorder. But once those symptoms persist beyond a month, then we call that post-traumatic stress disorder. So how common is this, right? Everybody receives medical care. How common is medical traumatic stress? Well, there's not a lot of great data on this in general among all people, not just individuals with spina bifida. So in general, one study found that between 3% and 27% of adults will meet criteria for PTSD related to any trauma, not just medical trauma, at some point in their life. So that means like anywhere from 1 in 30 to 1 in 4 adults will meet criteria at some point for PTSD. Again, it's not clear what percentage of that is medical trauma, but that, to me, I think that's a pretty high number. Another study that was focused on kids around the age of 10 right after they had surgery, it found that these kids were meeting criteria for a range of mental health disorders. So 13% met criteria for PTSD, another 18% almost met criteria for PTSD, 6% met criteria for depression, 8% met criteria for anxiety, and about 16% met criteria for what we call disruptive behavior disorder, which is kind of like oppositional behaviors. So after kids went through surgery, a good amount of them were experiencing some negative psychological and behavioral consequences from that. And then lastly, there's another study that found that when parents experience medical traumatic stress, that can predict their child's symptoms over the next year. So really just kind of highlighting, which we know in general that, parents' well-being does impact the well-being of their children, but this study confirmed that it's the case with medical traumatic stress as well. So what about for people with spina bifida? What is the research on medical traumatic stress in the spina bifida community? Well, there's very limited research, unfortunately. We definitely need more research in kids and adults to understand, who is experiencing medical traumatic stress and why. We definitely need more research. So on average, people with spina bifida go through about 5 surgical procedures from birth to adulthood, and 88% of surgeries have occurred by the age of 18. And this could be a variety of surgeries. So the most frequent ones are neurological, so typically kind of related to shunts, but many individuals with spina bifida could have orthopedic surgeries, urological, gastrointestinal, or related to skin. So like I said, there is very limited to no research on medical traumatic stress within the spina bifida community. However, there was this one study that looked at parents of kids with spina bifida, both kids who were newborns and then kids who were school age, which is about 5 to 11 years old. And what this study found was that of all these parents, about 75% of them experienced medical traumatic stress when they first learned about their child's diagnosis. And in most cases, it took about, within 4 years, that medical traumatic stress had kind of gone away. But there was a percentage of parents where it didn't go away. So about 30% of mothers and 20% of fathers were still experiencing some ongoing medical traumatic stress, even when their child was, school age, between the ages of 5 to 11. And that doesn't imply that the traumatic stress was from the diagnosis. It just highlights that there's a good percentage of parents who experience medical traumatic stress while they are going through the kind of journey of medical care for their child. Okay, so who exactly is at risk for experiencing medical traumatic stress? Well, here on this slide, I have a list of quite a few things that could put someone at stress. If one of these bullet points describes you, that doesn't mean you definitely will experience medical traumatic stress. But from what we do know in the research that does exist, we have found that these are factors that might make it more likely for someone to experience medical traumatic stress. So if you have had a prior post-traumatic stress experience, that's going to make it more likely that you experience traumatic stress in the future. If you have an existing mental or behavioral health condition like an anxiety disorder or depression disorder, that will also put you at risk. Other things like if you have intense fear before, during, or after the medical event, or if you experience a high level of pain during or after a medical event, these could increase your risks. If you are someone who doesn't really have a lot of coping strategies in general for managing stress, this is something that also can put you at risk. And then other factors include if you're someone who is isolated socially, meaning maybe you don't have a lot of family and friends in your life that support you, or if you're younger, if you're a woman, if you're of low income, if you have a physical disability or an intellectual disability. These are all factors that might put you at greater risk of experiencing medical traumatic stress. And lastly, the research has kind of found that for those who might be considered part of a socially disadvantaged group or background in general, you might be more likely to experience medical traumatic stress. So this could be something like being part of a minoritized group because of race and ethnicity, or because of like sexual orientation. But the research is a little bit mixed on that. But so you could see here, there are a variety of things that could potentially put somebody at risk. So now I'm going to pass it over to Dr. Simpson. So I'm going to, Dr. Simpson, give you control of the slides. I'll do that now. And she will talk more about how we can manage medical traumatic stress. Okay, I think you're all set.
Thank you. And I just wanted to just pause quickly and say I've been watching the chat, and I'm just really happy to see comments that this feels helpful for everyone, because I certainly know for our patients we work with, this comes up quite a bit. So it's great to be able to offer more information to the community at large. Okay, so after Dr. Papadakis did a wonderful job giving us the overview, now we're going to jump into talking more specifically about how to manage medical traumatic stress. And hopefully, oh, good, it works. Okay. So starting, the place to start is what can we do to try to prevent medical traumatic stress to begin with? And I think, one of the biggest areas of prevention, I also kind of see it as, intervention, it begins with our medical providers. So really asking your medical providers about how they can help you. Now this depends and varies based on the healthcare system that you are, that you attend and you belong to. But the healthcare system may even have a defined protocol of how they are assessing for traumatic stress in children and or adults, and certainly how they can help intervene and treat these symptoms when they see that come up for for you as their patient or for a parent of a patient. So some of these protocols include systematic screenings. So actually either having a questionnaire that a child, adolescent, or an adult fills out, or having a questionnaire that a parent fills out. It can also just include having the physician or a social worker or perhaps a psychologist in clinic meet with you as the patient, meet with you as the family, to proactively assess for some symptoms that could be already present, or some of these distress factors that could be there before a medical event may be coming up. So what you're seeing here, this DEF protocol, is a protocol that is available on the National Child Traumatic Stress Network website. And we do give you links at the end of this presentation for that website specifically, excuse me, because they have tons of really great resources for parents of children, for providers. It's a really great resource to have. But this is a protocol that was designed to really help assist providers proactively address stressful symptoms that can occur in the medical setting. But not only is this helpful for providers, I think it's also very helpful for parents and even children and adults, because it addresses three main components that we find very important when intervening with medical traumatic stress symptoms. So this first area, distress, I think this is a huge one that comes up for a lot of the families that we work with, where there's a big need when anyone hears about having to have a medical procedure, whatever that medical procedure is, there's a lot of thoughts and feelings that can come along with that immediately. And like Dr. Papadakis had just mentioned, those thoughts and feelings and reactions to hearing about a medical procedure or a surgery that you might have to have vary for every individual. But what we do know that can really help in reducing that distress is information. I have worked with a number, I've had the opportunity to work with and talk with a number of young adults who have gone through many procedures in their life. And one of the things I hear most often is that they did not have enough information going into a surgery or a procedure. They really didn't know what to expect. They had no idea what was going to happen from the moment they got there to as the procedure was taking place. And many of them recall that procedure being incredibly scary, because if they were getting information, that information was being provided to them in the moment when things were happening, and it just didn't give them time to process what they were hearing and to really feel like they had good understanding of what was going on. So I think making sure that providers are providing this information, but also that you as the patient, you as the parent, feel confident in asking for the information, and really making sure things aren't moving forward until you have the information. So that's one very important part. Then this next piece, emotional support. So for children, really encouraging parents to be with their child as much as possible. And usually this is not something parents are refusing. They want to be with their child. But sometimes in various circumstances, children can be separated from parents, or parents may not be able to be in the room the whole time. We know with certain exams or certainly surgical interventions, parents can't be there the whole time. But as much as possible, having parents or a loved one, a partner, someone who feels supportive to you, to be there to help comfort you and help you through that experience. Family is another huge component when we are looking at assessing and treating children and families, individuals with medical traumatic stress, because the family, gauging a family's level of distress and other life stressors happening for a family have a very big impact on how a child or an individual may cope with a procedure or a medical event. And if there are things that we as providers or other resources in the community can do to help alleviate some family distress that they're experiencing or provide additional resources, that we definitely want to be able to do that proactively to help assist in reducing these stress symptoms as the medical procedure occurs. Another more specific intervention that can be really helpful for children and for adults in, kind of shaping this in a little different way for adults, but oftentimes creating what we would call a social story, or really like a plan of action that can help you think through what happened. So this would be something that you could do following a medical event that was perceived by the child or the individual as traumatic. Kind of walking through, a story of what took place, and not only defining what happened, so those more objective experiences of what happened, but the feelings associated with what the individual experienced or the child experienced. And by walking through the story, you're actually, it's a way of challenging that avoidance that Dr. Papadakis had just talked about. Avoidance is one thing we really try to do when we have a traumatic experience. We don't want to talk about it. We don't want to revisit it. We want to just avoid, and that doesn't actually help us in the long run. Avoidance is the opposite of what's going to help, but by creating a story such as this, and even just being able to talk to someone about your thoughts and your feelings and what you experienced, that in and of itself can help alleviate some of these post-traumatic stress symptoms you can experience or your child can experience. And then it's always good after you kind of talk through a story like this to also really identify, what makes me feel better in these moments when I'm thinking and feeling, when I'm having thoughts and I'm sitting with these feelings related to this event. What can I do to help myself feel better? This is another example, and again, a lot of these resources you can find on the National Child Traumatic Stress Network website. But another good intervention or a resource to help either your child or yourself cope and adjust following medical trauma can be to really try to set some goals. So one of the things that post-traumatic stress symptoms do, like I just mentioned, is they make us typically withdraw from others. They make us, those symptoms kind of make it so we don't want to be around maybe our loved ones or friends or other people as much as we used to. They make us avoid places or things that might potentially remind us of this traumatic event and so forth. But by doing those things, it really only makes the symptoms worse, not better. And so by breaking down, starting with identifying a goal. So thinking about the things that used to really, bring you pleasure and things that you used to enjoy doing, so for a child, it might be getting back to school and seeing my friends again. For an adult, it could be, I miss going out to dinner with my friends, or I really want to go see a movie. I haven't seen a movie in a really long time. That used to make me feel very happy, but I don't want to do that now because of these post-traumatic stress symptoms I have. So kind of setting this goal and then working backwards from there. And so you have your large goal, but then you really want to kind of create these small steps that help you get there. And some of those steps certainly can be asking for help. And that can be asking for help, again, from family, from a parent, from loved ones, from a partner. It could be asking for professional help. It could be reaching out to your primary care doctor, or for a parent, kind of contacting a pediatrician to ask for a list of resources for mental health providers. But so asking for help could be the first step, then making a plan. And certainly another step could be what we just discussed, is talking about what you experienced, creating that social story, not avoiding the thoughts and feelings you have, but really trying to kind of put those thoughts and feelings down and acknowledging them. And then slowly you work your way to meeting that goal. And really with the overarching kind of goal of trying to get back to those things that you enjoy, getting back to your life. So this slide specifically focuses on parents and how parents can help their kids. So we really want, as parents, to encourage your child to talk about the medical event and their reactions to it. Oftentimes parents ask us as providers, like, should I bring it up? It's something that feels so upsetting to them. And honestly, it's something that feels so upsetting to the parent. It can be hard to want to bring it up. But we know from research, and we know from experience that encouraging your child to talk about what happened is important and helpful. And it's a balance, it's not kind of pushing, but it's just encouraging and then waiting and listening. Asking your child, answering your child's questions honestly and listening for those unspoken worries or fears. And it's okay as a parent to say, I don't know the answer to that, but I hear what you're saying, and it seems like this feels scary to you. So trying to really reflect and validate the feelings that you're hearing, and that it's okay to not have the answers, because you're not going to all the time. Support your child in participating in normal activities, school, friends, as much as possible. And this goes for adolescents and young adults too. We want to get back to those activities, even if we don't feel ready totally, because those activities help us feel safe, help us feel normal, those normal experiences, and help us kind of get us out of that trauma mind frame, that kind of feeling so stuck. So supporting your child and getting back to those typical activities. Certainly getting professional help if you're concerned about your child. And one of the biggest pieces is also, if you notice as a parent that talking about your child's medical trauma brings up distress for you or causes upset emotions, it's incredibly important for you to be able to find to ask for help and seek support, because the more parents can get the help they need, and the more parents feel like they can work, or that they have addressed their own feelings related to the trauma, the more readily available they're going to be to help their kids. And I know this is a tough one, because parents, they put their kids first all the time. And that's what good parents do. But in so many circumstances, when it comes to your child's mental health and your child's well-being, parents have to take care of themselves first to be able to help their kids the best way they can. So I hope that message is heard, that it's important for parents to seek support as well, and for providers to be able to help find support for parents. Another helpful, I'm not going to go through each one of these points because I definitely want to save time for questions. But this is another really helpful document that can be found in the National Child Traumatic Stress Network, that really walks through steps to help your child after they've experienced a trauma. Many of these things we've discussed, but please check out this resource if you find it helpful. And another important intervention that we wanted to highlight today, and this is an intervention that's been studied on the full lifespan of ages, so not just for children and adolescents, but for adults as well, is something called trauma-focused cognitive behavioral therapy. And this is a therapy that is it has very specific components that have been proven to be effective in reducing post-traumatic stress symptoms after a trauma. And these are some strategies such as learning relaxation techniques. Relaxation techniques are incredibly important for reducing that physiological response we have in our body when we experience trauma. So things like your heart racing, or that muscle tension you can experience, or stomach upset. All of these relaxation strategies can really help reduce those physiological symptoms. Building awareness of the way we think about the trauma, and oftentimes trying to restructure the way we think to be more helpful. Sometimes when we experience trauma, we can get stuck on thoughts that really don't help us. They may be valid, they may be accurate, but even if they are, they're not helping us move forward. And so this therapy, this treatment intervention helps us look at our thoughts, and if needed, trying to kind of restructure those thoughts to be more helpful and encouraging. Part of this treatment is also creating something that's called a trauma narrative, which is telling our story, being able to talk about our story and even outlining it through writing. Is, like I mentioned, is a form of exposure work. It's facing that fear instead of avoiding it. And over time, the more we face the fear, the more we are able to talk about what's happened to us, the less powerful those experiences become. And lastly, learning how family members can continue to be supportive as you're working through the trauma you've experienced. Okay, so these were some of those links that I had just mentioned. Many of them are to the Child Traumatic Stress Network. This last one here is actually to the TFCBT network, or TFCBT website. And on this website, I do want to let everyone know, it's a national website where it does have a link that where you can search for providers that are certified in TFCBT in your state and region. So it doesn't necessarily mean that those providers are in network from an insurance standpoint. So I'm not guaranteeing that, unfortunately, but it's definitely a good place to start when if you're looking for an evidence-based treatment for trauma. And then also another excellent place to start is just asking, whether it's your pediatrician, whether it's your primary care doc, or the medical setting that you seek your care, asking them for resources for mental health support is a great place to start. Okay. We definitely want to be able to answer some questions. I know the chat there's been lots in there. And Jackie, I know I said I was going, have you seen any questions specifically that we should start with? I know there's quite a few.
Thanks.
Sorry. I was just going to say, I'm sorry, Tess and Jackie. So there is one question from Adam. Is that the one you're seeing?
Let me scroll back down.
It says he's mentioning that he sees a lot of parents in the Spina Bifida community that only talk to their kids about things that are relating to their disability. Eventually, those kids become adults who only know how to relate to others through their disability. So what advice do you have for parents to break out of that habit and to just treat their child like everyone else?
That's a really good question.
Mm-hmm.
So not specific to just talking about kind of like medical trauma or medical procedures, but more just talking about, I guess I'm trying to still kind of wrap my head around that question.
I'm gonna just reread it, make sure I understand it.
I know.
It's a good question. I just want to Adam, if we are getting this incorrect, please type in again. But what I hear your question asking is how, from your perspective, you see a lot of parents maybe kind of overly focus on their child having spina bifida or the disability of spina bifida, and that kind of takes up a lot of who this child is or their sense of identity. And so then when they get older, like kind of their disability or having spina bifida is kind of at the forefront of how they interact with people. If that was indeed kind of what you were intending, I think that's a really good question. And I think that's a good question to think about. Again, it's not necessarily related to medical traumatic stress as I'm reading it, but I think that is something to think about, not just for parents, but for individuals in general. Often some of the kids and young adults I work with, an exercise I like to do with them is spending time to talk about identity. You know, who are you? What are the parts that make up you? And what I mean by that is like, what are the roles you play in your life? Are you a daughter? Are you a son? Are you a best friend? Are you a student? You know, what are the things you're good at? What is it that makes you you and not somebody else? What is it that, you know, makes you unique and no one else can kind of claim? And really kind of working on kind of just exploring all the things that make you feel good about who you are. And I also do want to note that some people might have a lot of pride and positive feelings about their disability and having spina bifida. And so if that is the case, then it would certainly be okay if that is kind of at the forefront. But maybe if that isn't the case for some individuals, then it's about how do I kind of emphasize these other parts of myself. I don't know if that answers your question.
He said, thank you. So yes, thank you so much.
Great.
Yeah, he said, thank you. I've been saying that for years, and many in the community think I'm being ableist for that. So thank you, Jackie, for that.
And we did receive many wonderful questions from audience members prior to our presentation today. And if there aren't any other specific questions,
And Tess, before I also just want to comment on some people's comments in the chat, and then maybe we could go to some of those questions. As you alluded to earlier, Tess, when we were kind of transitioning between the two of us talking, it seems like few of you who have commented in the chat really are acknowledging that perhaps you've experienced medical traumatic stress or your child has, and this is something that's relevant to you. And that it seems like some of you are saying that maybe you have felt alone in this in your life. And, you know, someone commented that they feel less alone, just happy seeing this presentation. So I just want to say that again, you are certainly not alone. There are many, many people who experience medical traumatic stress. And unfortunately, it kind of feels like this is something that could be kind of prevalent in the spina bifida community. And that is why, you know, I think, you know, Tess and I dedicate a lot of our professional time to the spina bifida community, and the Spina Bifida Association obviously is dedicated to improving the lives of people with spina bifida. And so I hope that maybe there could be more attention and to this so that we can help reduce this for people. You know, something I wanted to also call out based on a comment I saw, someone said like social stories are great. That Tess was talking about a trauma narrative. I just want to emphasize how powerful a trauma narrative is. From my experience as a clinician, I've had the opportunity to work with a lot of kids and adults, you know, some in their into their 30s, who've experienced medical traumatic distress, sometimes when they were younger. And doing a trauma narrative can be very powerful, and you don't necessarily have to have a therapist do that with you in order for this to be a useful tool. Because I have heard other people do this on their own, and it's very powerful. And just to highlight again what that means, it means basically writing about your story. You know, some people might type it out, some people might record themselves on their phone, some people might draw pictures, but basically trying to tell your story. What happened? How are you feeling? What was going on? With the idea, and what happens next? You know, chapter 1, what happened before the event? Chapter 2, what happened during the event? And chapter 3, what is my future now? And the point of that is because the more we expose ourselves to that, it kind of takes the scariness and the pain out of it. And the more we're able to actually share that narrative with other people in our life who care and support who care about us and support us, that can also be incredibly powerful. So I just wanted to really highlight how that trauma narrative can be a really useful tool. And especially if you're someone who likes to journal, you're writing a diary or something, this could be something to maybe do. So sorry, Tess, go ahead.
No, Jackie, I love that you highlighted that. And I just want to add one thing to what Jackie was saying, because I agree. I don't, creating a trauma narrative isn't something you have to do with a clinician necessarily. But our one request as well is when you are creating your narrative or talking about your story, trying your hardest to do it without judgment. Because I think oftentimes when we experience trauma, we'll think back and stories I hear from the individuals I work with is I should have done this differently. Like, why didn't I tell them to stop and explain it better? There could be a lot of like guilt or self-criticism. And even for parents, like I maybe I should have made a different choice, or so we can't change what's happened. And this is true in all experiences, but certainly when we're thinking about medical trauma. And so judging ourselves negatively about what has happened in the past is not going to help us now, and it's not going to help us move forward.
Mm-hmm.
So, and this is something that, I see people or individuals are asking about support groups, which I certainly wish I knew of some, and this will be something I think we, SBA and in effort, will continue to try to explore how more of those can be created. But even if you are sharing your story with a friend or a colleague or a parent, I mean, asking them to kind of keep an eye out for you using kind of judgmental language around your story. Like we want our loved ones to be able to say, wait a minute, like that isn't, don't blame yourself, don't criticize yourself. Like this is just about telling your story, but without judgment.
Mm-hmm. Mm-hmm.
If I hope that makes sense.
Yeah. Mm-hmm. I think that's great. So looking at the list of questions that folks sent in ahead of time, I want to just refer to one that it sounds like it was coming from adults with spina bifida. And let's see, one question said, how can we not let our trauma define our life, even though our medical struggles are permanent? How can we talk about medical trauma to doctors who don't seem willing to understand it, but they're your doctors and it's not possible to find another doctor in your area? So really that last piece, like how do we tell our doctors we've experienced medical trauma, especially if maybe you experienced this as a child and now you're adult, this is a different doctor. This can be really, really tough. But what I would say is that I do think it's important to be honest with your doctors and let them know how you're feeling. So for example, there's another question about what do I do when I have a lot of anxiety during medical visits? I think it's okay to tell your doctor, hi, I have a lot of anxiety when I go to the doctor. These situations make me nervous. I'm still working on how to cope with my anxiety, but I need you to know that this is difficult for me. And I think that's really important to feel empowered. And that's not easy, but to say that to your doctor. And I can't tell you how every doctor will respond, but most doctors they do want to take good care of their patients and they want to know how their patients are doing. So finding a way to say like, this is hard for me, this is giving me anxiety, or to then take it a step further. When I was younger, I had medical events happen that were traumatic. It is still affecting me today. Can we talk about how having this procedure, what supports your office or this hospital has for making this procedure easier for me? Do you have any resources? So just starting there is a really good place, just starting the conversation with doctors, because I would love it if every doctor started that conversation with you, but that might not be the case. So just feel empowered, and maybe you have to practice having that conversation before you go to the doctor. Maybe you need to practice with a loved one or a friend, like, okay, how am I going to say this? Because it could be hard. It could be hard to be vulnerable and say something like that during a doctor's visit.
I was going to piggyback off what Dr. Papadakis just mentioned, and also kind of talk another question that had come through was related to, you know, how to cope and how to manage unplanned emergency visits when you already have medical trauma. And I think this is another really great question, because again, we can't always predict when things are going to happen, and we have to seek medical attention quickly or urgently. And I think it's good to think through what could help. And so thinking about like creating, and this goes for, you know, we talk about this a lot to parents with kids, but this goes for adults too. Like thinking about the things that you do in your day-to-day life that helps you de-stress, helps you feel safe, helps you feel comfortable, and almost kind of like having a bag ready, a bag packed with some of those tangible tools. So this might be, you know, making sure, and even as adults, like we have objects in our life that bring us comfort. So it could be a photograph of a loved one that just anytime you look at it makes you feel calm and makes you feel peaceful. I mean, ideally, it'd be amazing if that loved one or that person is close enough that they could be with you if needed during these stressful, urgent medical visit. But if not, a photograph or a keepsake of some kind. For kids, we talk a lot about having kind of favorite stuffed animals or favorite blankets or coloring books. And there are actually adult coloring books that are incredibly useful and relaxing, almost like a meditation, that I think are wonderful. But kind of really thinking about like, what are the things when I know I'm in this situation that are going to just help me feel as calm as possible. Could definitely be like making sure you have headphones to listen to some calming music, listen to an audiobook. I don't know, Jackie, are you thinking of anything that I can't think of right now?
No, I'm blanking out now, but I think along with that, like, yes, having your kind of emergency bag packed, and also this kind of goes along with like a social story, like kind of having, you know, having a social story for what an unexpected emergency could look like. And that could be something as simple as like, I know that at any time, whether I'm at home or I'm in the community or I'm at work, like something could go wrong. And that might mean that I call 911, a loved one call 911. That could mean I end up in an ambulance or someone's taking me to the hospital. That could mean I'm sitting in the emergency room for 5 minutes or 5 hours. And I know it sounds kind of silly, but actually kind of like writing a story of this is what could happen. Just doing that exercise forces you to kind of live through like, this is something that could happen, so that if it does happen, you're a little bit more prepared for it, because you're like, oh, I've already done this mental exercise. And so again, that I would kind of call that like a social story a little bit, but doing something like that is also an exercise that could be helpful.
I know we're nearly out of time, and Judy, you did want to wrap up.
Yep. Let me,
but I think Jackie and I both just want to thank everyone for attending and for interest in this topic, and certainly if there's additional questions, don't hesitate to reach out to SBA.
Tess and Jackie, look at this last question in the chat. That we attend a major children's hospital with no resources to help with medical trauma. What's the best way to start the conversation? What would you recommend as a, because I think probably this is the case mostly.
You know, one thing I've recommended to someone is sometimes if you print something out, like if you go to the National Child Traumatic Stress Network and print out a flyer that's like one of those flyers that says like, what is medical traumatic stress and how do you help your child? Bring that with you to the doctor and kind of use that as a tool to start the conversation. Like, I came across this resource and I want to talk about this with you today. That can be a really, especially when this is like a really nice validated resource, it can also really help that doctor and be like, oh, okay, we're talking about the same thing. Let's talk about this. So if you can bring something tangible like that, or even if you just if you Google medical traumatic stress and then print something out and say, hey, this is something that's important to me. Can we talk about it? That could be helpful.
And take a look at the resources that Tess and Jackie have provided that you'll get when you receive this recording. Tess, I'm sorry.
No, and I know we're out of time, but the last thing I mentioned, and I saw it in the chat as well, as a response to someone else's message, but for any major children's hospital, you should also have something called like a patient advocate or a family advocate service line or contact.
Mhm.
And if you, I always recommend, like Jackie mentioned, starting with your provider and giving, you know, this type of information and saying, look, I need this help, we need this help, how do we get it? But if you've done that and you don't feel heard, I do recommend taking it to the next step and contacting the hospital advocate.
Yeah. And don't forget to ask, is there a psychologist, a social worker, or some other mental health or behavioral health provider available? Can you speak to that person? You know, definitely a child life specialist, definitely ask that question.
Thank you, Dr. Simpson and Dr. Papadakis. This has been an excellent session and on a topic that's we know is very important because our community has told us this. And you can let us know, everybody, if you'd like another session about this, we'd be glad to plan that. For now, our next community information session will be on July the 15th at 7 p.m. For whom the bell tolls, coming to terms with death and spina bifida. So we hope that you will take advantage of that opportunity, and we appreciate your being with us tonight. Thank you, everyone.
Thank you.
Thank you.